This is BayRadio.
I'm Jeremy Kenton. A study has found that people with symptoms of cardiovascular health issues such as angina and heart palpitations tend to drink less coffee, avoid coffee altogether, or drink decaffeinated coffee. Now, the scientists have used a genetic technique to show that these symptoms determine the amount of coffee people drink rather than the other way around. And the new study suggests that people with a high genetic risk of cardiovascular disease unconsciously reduce how much they drink to avoid the unpleasant cardiovascular symptoms such as a raised heartbeat or palpitation. And we all know what that's like if we drink too many coffees. Now, when they analysed the data, it showed that having a particular genetic variant determined how much a coffee person actually drank. So, people vulnerable to high blood pressure may simply be avoiding the drink coffee because for them the caffeine is more likely to cause the unpleasant symptoms. But what this means is that someone who drinks a lot of coffee is likely more genetically tolerant of coffee and the caffeine within it as compared to someone who drinks very little. And a non-coffee drinker or someone who drinks decaffeinated coffee is more likely prone to the adverse effects of caffeine and are more susceptible to high blood pressure. So there is this genetic predisposition that actually makes you choose whether or not you're going to drink coffee or not. And a new study has explored the link between muscle weakness and type 2 diabetes. In type 2 diabetes, muscle strength is reduced and the ability of muscles to take up glucose is impaired. Now, a new study has identified a gene that is linked to that muscle weakness, and the research showed that the gene, which normally plays an important role in muscle regeneration, is silenced in people with type 2 diabetes, and the discovery offers new possibilities for developing treatments that restore muscle function and boost glucose absorption. And every week it seems to be an international week of this or that, but this week is actually something that has particular relevance to my actual profession, and it is International Osteopathy Healthcare Awareness Week. Now, osteopathy has been around since the 1870s, 1880s. It started in America and is regulated and recognized in most countries now throughout the world. But what do osteopaths actually do? So bear in mind the fact that we as osteopaths are primarily there to help restore normal function, and we do this by a number of methods. It's not just about cracking bones that people seem to sort of associate us with, and nor is it just about bad backs. Our role really is in terms of diagnosing what the problem is and then treating once we're satisfied with that diagnosis. Obviously, the main thing that we're well known for is treating spinal issues and reducing pain, and we do that by trying to increase the level of mobility, trying to make your spine move or make other joints move as well. Remember that osteopaths are there for helping lots of issues, not just spinal, but hip problems, knee problems, sports injury, ankle problems, tennis elbow. The list is endless. Headaches, migraine, back pain during pregnancy. So there is an awful lot that osteopathy can do to help with your musculoskeletal conditions.